What's going on, everybody? Welcome to the webinar tonight. I'm really excited about this. This is our first webinar, and it looks like we've already got 900 people in the room. So I'm really excited about this, you guys. And before we get started, just where are you guys from? You guys know me. I'm from Texas. It's a great day here in Texas. Hi, everybody. Gabby, Tracy, Norma, Amy. Okay, it's going really fast. So where's everybody from? Nurse brothers, nurse sisters. What's going on, everybody? I saw Virginia Beach. I saw California in there. I saw Florida, Texas. All right, another Texan. Texas, Oklahoma. Nice. Michigan, Boston, Venezuela. That is incredible. Awesome. Colorado, New York, Spokane, Austin, Texas. Love Austin, Texas. Memphis. I'm trying to catch Boston. I love Boston. Boston is one of my favorite cities to visit. My sister has run the Boston Marathon a couple times, and it was such a great time to be there. Let's see. I saw Washington. Love Washington. Let's see. Cassandra from Nebraska. We've talked before. How you doing? So what's going on, guys? What's going on? What year are you guys in nursing school? Because right now we're going to be talking test taking strategies. So this is going to help you whether you're in your first year of nursing school. If you haven't started, New Zealand. I saw New Zealand. My wife and I traveled to New Zealand before we had kids. It is an incredible place. Australia, cool. Junior, senior, first semester, last semester, awesome. Anybody out there already take the NCLEX? Senior, first semester, graduated, awesome. Good. So we have people from every stage of nursing. Take the NCLEX, great. Guys, this is awesome. I'm excited that we have people from every different stage in this. Okay. So you guys, I'm so humbled that you guys are here tonight. I'm so excited. We have right now, it looks like about 1,200 people in the room, and I am just really excited to share this stuff with you too. Got ATT, awesome. That ATT is authorization to test. That means that now you can schedule your NCLEX and go for it. So cool. I hope this really helps you. Taking the NCLEX, good. You guys, I'm excited about this. I want to bring you guys as much value as we can. I'm going to go ahead and switch over here to share my screen with you guys. And what I have on here, guys, let's see. All right. So what we're going to do, guys, failed the NCLEX twice. We're going to help you here with that tonight. We're going to help you that. Carolyn, about to sit for the NCLEX. Remar review, great. I've actually had Remar on the podcast a couple times or once. So what we're going to do, guys, is we're going to talk how to pass any test in nursing school, okay? So I'm really excited with this. You guys, I learned these steps, these tips, my first semester of nursing school. My school had a student success center. I read a few books, and I analyzed all the tests I had taken because, as you guys know, taking tests in nursing school is not like taking a test anywhere else, okay? And you guys, let me say one thing really quick about the chat. I have my wife, Sandy, manning the chat as well as she can. We had a much bigger turnout for this than we thought, but she's going to try to manage the chat as best as she can. If you guys have, the webinar should last about 45, 60 minutes. We will have a replay as well that you'll get a link in your email for eventually. So she's going to man that as best as she can. I'm going to also go back and respond to questions later, but I want to try to get through this information. And so I'm going to try to get back to this as quick as we can too. So you guys know that taking tests in nursing school is not like anything else you've ever done before in your life, right? I want to tell you guys a quick story. This is me a couple haircuts ago with my son Taz and my daughter Kai. You can see how excited she is. And last fall, I took my kids and my wife. We went to Croatia, and we were there for a little bit. Stayed in Airbnbs. It was just an incredible time. And this is me, jumping into the ocean. Now, one of the things we visited while we were in Croatia was this national park called Krka, Krka. It was a spectacular waterfall. We woke up really early one morning, took a 2-hour bus ride, then a 30-minute, 40-minute boat trip, and then we hiked up around this mountain here. And when we came back down to this little pool here, we found out that you can swim in it. You can swim up to those waterfalls. So awesome, right? Great experience. So my wife and I started swimming in there with the kids, and then our kids started getting tired, right? Everything was beautiful. Everything was perfect until it wasn't. After about an hour or so of playing around there, my daughter, Kai, she's 3, she started getting tired. We didn't plan very well for this trip. And I realized very quickly, oh crap, I'd taken my daughter away from my wife and my son, and I'd taken her over to a beach area. And once I realized she got tired and she was ready to go, she started getting upset. Um, I realized there was a huge crowd, and I had no phone. There were no phones that we could use. Our SIM cards didn't work. We didn't speak the language. Croatian is a very odd language. There was no transportation. There was no way to find my wife. They didn't have a PA system. My daughter was crying, and I didn't have any clue where my wife was. So I realized very quickly we were lost, and I had no way of getting back. Okay, and I want to liken that really quickly, you guys, to becoming a nurse. You guys know exactly where you want to go as nurses, right? You want to become an RN. Some of you are just starting the path. Some have your ATT. Some already have your NCLEX scheduled. But what happens a lot of times, guys, and what we're going to try to help you with tonight, is that sometimes we lose our direction, okay? The how becomes lost, okay? Does any of this stuff sound familiar? You've probably seen some of these memes. Some of the memes are, so if you guys aren't seeing anything, just click refresh. Some of the memes, nice try, but that answer was not the quote unquote most correct answer. This baby here, hold up. That's not what the book said. And then this comment down here is one we got on our Facebook group really recently. Someone stated that they just came from one of the most confusing senior lectures ever. The professor made them feel like idiots, asking stuff that they had never heard of before, assuming they knew everything on the PowerPoint. Test is on Monday, right? I think a lot of this sounds familiar to you guys. Our mission at InterSNG, I know a lot of you probably know us. A lot of you are familiar with this. Some of you may not know what we do. Our mission is to provide tools and competence to help you succeed. We don't adopt the popular framework of the School of Hard Knocks, or it was hard for me, so it should be hard for you guys. We don't want you to just drown in information. Instead, we want to provide you with everything that you need to know to learn it well. Okay, and that's what we're going to do today. What we're going to learn today is I'm going to share with you guys 11 actionable tips for analyzing nursing test questions. And what I want you guys to get from this, my goal is that you're going to gain a renewed confidence when entering your next test. Okay? So, as we get going into this, guys, this method and what I'm going to teach you, these 11 steps, I think you can start applying tomorrow on your next class, okay? So I want you guys to focus, though. I want you guys to close Facebook, close Instagram, Snapchat. I want you to put your phone down and really dial into this lecture. And if you have a minute, grab a piece of paper, grab a pen. But you guys, I am going to give you some notes at the very end. I'm going to give you this nice PDF that kind of has all these 11 steps outlined, but you will remember much more what you take notes on. Okay, so take some notes, take out a pen and paper. Even if you throw them away after this webinar, take a couple notes. So who is InterSNG? What we are is we really are a community of nurses focused on changing nursing education by providing you the tools and the confidence to succeed in nursing school, on the NCLEX, and in your life. We really try to do that by cutting the fluff and giving you what you need. These 8 people here, this is some of our team. Okay, up here in the left is Heather. A lot of you have probably spoken with Heather over social media. This is my wife, Sandy. She's manning the comments here. Hi, Sandy. Thanks. This is me down here in the bottom right corner. We have Susan and Katie. You guys have probably heard before. And then we have Anna, Nathan, and Taylor. This is part of the team, you guys. I'm very proud of this team. I'm very excited for this team. So can someone mention to people who aren't seeing the webinar yet to refresh their screen? I think that's going to help. All right. So let me tell you a little bit about myself. I'm RN, BSN, BS, CCRN. I had a previous degree before going into nursing. I founded InterSNG in October of 2014. That's when our very first podcast went live. I've been a neuro ICU nurse, a co-team nurse, a preceptor, a charge nurse, and now, a teacher with InterSNG, and I love it. Now, the reason I started InterSNG was about a year into my career as an ICU nurse, I realized that I hadn't been taught the way I should have been taught. I realized that there were some ancient teaching methods being used, and I realized that nursing students deserved better. I've told the story a few times before, about some of my precepting experience with student nurses, and I just realized there has to be a better way. So that's really what we did, and that's what we started. So in the past 2 years, we've had about 4 million visitors on our website. We've had about 2.5 million podcast downloads. We have currently about 200,000 social media followers. We've had people visit our site from about 207 different countries. So that's out of about January 2017. So we've helped scores and scores and scores of nursing students, and I'm always humbled to hear, even just reading your guys' comments here, is humbling to me, you guys. I really love it. Okay, so you guys, I'm sorry, my daughter just walked in the room here. So I'm always really humbled whenever I hear from a nurse or a nursing student who has used our stuff. Sorry, that was my daughter Kai. She just woke up and she wanted a drink of water. Thanks, guys. Yes, we are live. Yes, we are definitely live. We had put her in bed at 6 o'clock and she apparently didn't fall asleep. So anyway, my favorite comment from a nursing student was, thank you guys, thanks Chandra, was when I'd responded to somebody over email and she said that the response I gave her brought her to tears. She felt like someone finally believed in her and someone finally cared about her. And this is truly humbling to me, you guys. I really, real life nursing, I really love being able to reach you guys and provide you guys the tips and the confidence to succeed. So I want to tell you guys a secret, and this might make some of you mad when I tell this secret, but here we go. The NCLEX isn't hard, okay? You just have to know your enemy, okay? It's kind of like G.I. Joe says, and I think that's G.I. Joe, right? Knowing is half the battle, and that might age me a little bit. Some of you guys are probably a lot younger than me, but knowing is half the battle. So the NCLEX is a beast. Nursing school tests are like nothing you've ever experienced before. You know, in your anatomy classes and things like that, you're just being tested on memorization, rote memorization. Can you remember what bone this is, etc. The NCLEX is different, okay? And what we're going to do is we're going to talk about 11 tips to help you understand that. So let's get into our first tip. All right, here we go. The first thing I want to cover, of course, is SATA questions. Now, who knows what SATA question is? SATA stands for Select All That Apply. All right. This is where more nursing students struggle than any other area, okay? I'm going to give you 3 things to do to conquer SATA questions, okay? And I'm going to call this the SATA success pyramid, okay? The first thing I want you to do whenever you get a SATA question is I want you to cover all the options, okay? Whether you have 4 options, 5 options, 6 options, I want you to cover them all up, okay? I'm going to tell you why I want you to do that. And then I want you to evaluate each option individually, all right? And then I want you to change the question to a true-false statement. Because what happens here, what happens with SATA questions, you guys, is a lot of times people will start to try to bunch answers together. They'll say, okay, well, if A is right and B is pretty close, they must be the same, so I'm going to kind of bunch them together. That's where a lot of nursing students get stuck, is they start bunching answer options together, all right? And you can't do that. I want you to cover all the options first, evaluate each one individually, and then rephrase the question as a true-false statement with each individual option, all right? So that's our first one. Second tip is something called absolute words, okay? Have you guys heard of absolute words? Who knows of absolute words? I want you to take absolute words as red flags, okay? Absolute words are the words always, never, none, all, every, all right? If an answer option contains one of these words, it is generally a good indication that it's not a correct option, okay? Because it's really hard to say that any one intervention, any one thing applies to every patient across every population, across every disease process. So if you see one of these 5 words, it's always a really good indication that it's probably not right. And I see Tori up there says only can also be one as well sometimes. So, but however, sometimes you might see an absolute word and think it is correct. If this happens, I want you to ask yourself 2 questions. First, is it a safety issue? And can it be applied to many kinds of patients across a lot of different spectrums? All right, so if you see one of these words and you're like, man, but that really just seems right, ask yourself, is it a safety issue and can it be applied to many kinds of patients? And so, yes, Susan's saying up there, what about always wash your hands? Washing your hands is a safety issue and it needs to be applied to every kind of patient. The example I'm going to give you here is like never lift a Foley bag above the bladder. The reason that works, it's an absolute word, but the reason it works is because it's a safety issue. If you lift the bag up, the urine's going to backflow. It's going to cause a CODI. It's going to cause, it can cause a bladder infection. And so it's a safety issue, and it can be applied to patients in a PED setting, an OB setting, a med-surg setting, in any kind of setting. All right. So that's absolute words. Here's a quick example of this. And I want you guys to go ahead and put your answer up there. Which one you think it is? How can the nurse best improve circulation when caring for a patient, when giving a patient a bath? 1, apply soap to the washcloth, keep the patient covered, use only hot water, use firm strokes. Now, some of these are going to be easier than others, but apply what we just learned here. Option 3 has the absolute word only in it. Use only hot water. Obviously, you don't want to do that. All right, so good. Yeah, pretty much everybody's saying 4, 4, 4, 4, 4. A couple of people saying 2. So 2, we'll just touch on that really quick. 2 wouldn't be correct because keeping a patient covered isn't going to help with circulation other than keeping them warm, but the firm strokes is going to help push the blood, okay, and keep that venous circulation going. All right. Now, another great testing strategy is opposites. Okay, some of these strategies are a little bit more in depth than others. Others I just want you to know and be familiar with. So with opposites, what we're talking about here is we're talking about if you have opposite answer choices, one of them is usually correct, okay? So if you have like hyperkalemia and hypokalemia as answer options, usually one of them is going to be the correct answer. So examples of this would be like hyper versus hypo, acute versus chronic, overload versus deficit. All right. Now remember, content knowledge is always number 1. That matters more than anything. If you know an answer, go with it. But if you see things that are opposite answer options in your 4 choices, usually one of those ones is going to be the right answer. All right. Here's an example of this. And this one's a little bit different, a little bit tricky, but the physician orders anti-embolism stockings for a patient. When should the anti-embolism stockings be put on? Okay. Option 1, when the patient is still in bed. Option 2, when the patient complains of leg pain. Option 3, when the patient's feet become edematous. Option 4, after the patient gets out of bed in the morning. All right, what do you guys think? 1, 1, 1, 1, 1, 4. Great. So a couple people are saying 1, or most people are saying 1, a couple people are saying 4. What I like here is that you guys have identified the opposite options. The opposite options are 1 and 4, while the patient is still in bed or after the patient gets out of bed in the morning. That's great. So you've identified the 2 opposite options and saying, okay, that's probably right. Then what you can do is you can read 2 and 3 really quick. But in this one, obviously reading 2 and 3, we're just dealing with, we're putting the stockings on after there's already a problem. So we need to look at 1 and 4 a little bit more closely while the patient is still in bed. Okay, this is when we apply our nursing knowledge, regardless of where you are in your nursing program. The nursing knowledge you would want to apply here would be, okay, I know that edema is going to occur as the legs become dependent, and feet are dependent when the patient's standing up. So I'm going to put them on before the edema occurs. So option 1 would be the right answer there. All right, this one's a quick tip here. 4 is same. Okay, same. What we're talking about here is answer options with the same concept are usually false and you can move on. These can be hard to spot, okay? An example of this would be like a patient rating pain of 8 and a patient saying that they have really terrible pain, okay? A pain of 8 and terrible pain are kind of the same thing, so you can really just move on. They're equally plausible, and they're both kind of saying the same thing, so you really just want to move on, all right? That's the same, okay? That's tip 4. We're going to do a question here. This one's just a little bit different, okay? What is the main reason why passive range of motion exercises are performed? Okay, let's look for things that are saying the same thing. If they're saying the same thing, they're generally wrong. Increase endurance, prevent loss of mobility, strengthen muscle tone, maximize muscle atrophy. So the same thing that we're talking about here are things like increase, strengthen, maximize. Things that are increasing, right? The only one that's not increasing something is 2, which is prevent loss of mobility. So even if in option 4, you don't know that atrophy is obviously something we don't want to maximize, okay, you can look at it and say prevent loss of mobility is the only one that's not increasing something. Therefore, I'm going to go with that option. All right. That's kind of an easy question. Everybody's saying 2, 2, 2. Yep, great. All right. Priority. This is the one we're going to spend the most time on. This is the one that I want you guys to really take the most notes on, and I really want you to get the most from this. All right. Priority questions. Why are these so important? Okay, you have to be able to understand nursing priorities. What's important to you? As a nurse, it's all about priorities. You're going to be given 10 million tasks to complete. And by the way, they all have to be done right now. So you really have to identify what has to be done first. Okay. Sarah's saying those are the worst. Yeah, they kind of suck. So first of all, let's talk about the NCLEX is really built on something called Bloom's taxonomy. All right. Bloom's taxonomy is a way to analyze how well you understand something, how well you cognitively mastered a topic. It starts at the bottom with remembering. Like, do you remember what a normal sodium level is? Okay. And then it builds all the way up to like analysis, where you can take a whole bunch of different pieces of information and you can put them together and come up with the right option. All right. And so this is where priority really comes into play. Okay. So how are you going to be able to identify a priority question? How do you know when the NCLEX wants you to know if you can pick the right priority? You're going to hear keywords like priority, emergency, a patient arrives via ambulance, a patient's returning to the floor, what's the most important, and see first. All right. So it's really built on Maslow, just like Daniel just set up there, ABCD and Maslow. What Maslow's hierarchy of needs is, hopefully you guys have all seen this from, your nursing 101 or your nursing entry to nursing course. Maslow's hierarchy of needs is built on what it really takes to build a complete human being, basically. And at the very bottom, we have our physiological needs, things like breathing, sleep, homeostasis, all the way up to things like creativity. Okay. So that's what it really takes to build a human. We can't worry about our self-esteem if we're not breathing. All right. So what it really comes down to, you guys, it comes down to ABCs. What are ABCs? Airway, breathing, circulation. All right. So that's really our first and most important thing that we have to address. ABCs. And you can see I added a little S here on our ABCs, right? ABCs, I'm going to call that S safety. All right. That's going to be airway, breathing, circulation, safety. All right. Then once we've dealt with those four things, we can deal with the patient's pain. Okay. Then we can educate the patient. And after that, we can deal with their feelings. All right. Now, I know in Nursing 100 or fundamentals, all you really seem to talk about is feelings, right? That's your feelings. But while we care about our patient's feelings, right? If they are not breathing or if their blood pressure is 20/5, but at the same time, they're telling us they're upset that their meal tray is cold, like, yeah, I care about the meal tray, but I really kind of care about their airway more than anything right now. All right. So we can't educate the patient if they're in a tremendous amount of pain, right? If they have a pain of 10, our education is not going to go very far. If there's a safety issue, we can't really educate. If there's a breathing issue, we can't really worry about their circulation. If there's an airway issue, that trumps everything. So what we're really doing with these is we're trying to identify which of the answer options is closest to A. Okay, which one's closest to our airway? And that's going to be our correct answer. Now, I'm going to give all this in the notes, but this is something that I think will really help you. This is going to help. What I'm going to do is I'm going to give you different keywords that are going to help you identify an airway, a breathing, a circulation, or a safety issue. So with airway, you're going to see things like NPO, gag reflex, breathing, water after surgery, dysphagia after stroke, and obviously just stating their airway. Okay. For B, you're going to see things like breath sounds, O2 administration, what's their pulse ox status, have you raised the head of bed, incentive spirometry. If you see those types of things in an answer option, you're dealing with a breathing type of problem. C, for circulation, the big ones are obvious: heart rate, blood pressure, CPR. But then you also have to think about fluid status, fluid deficit versus fluid overload. Are they having diarrhea or a lot of vomiting? That's going to lose a lot of fluids. They're going to have a fluid deficit there. Things like pulses. Do they have a weak and thready pulse? IV fluids. How much IV fluids are they receiving? Are they on TPN? Do they have central lines? Is there bleeding or hemorrhage? All right. And then safety. With safety, I want you to think about two things. I want you to think about physical safety and infection safety. So with physical safety, we're dealing with like rugs, night lights. With our dementia patients, that's going to keep them physically safe. Do they have a phone? What's their risk for falls? Walking after a narcotic. A lot of times you'll give a patient morphine and they're like, I'm ready to go. Let's take a walk around the unit. Or infection as well. So you have to assess infection, temp, hand washing, cultures, antibiotics, wounds, drainage. Okay. TPN is it's total parenteral nutrition. It's nutrition through an IV, basically. Natalie. Okay. So that's really what you need to keep to kind of know where something falls on the ABC scale. So if you have a patient with a heart rate problem and a patient with a GAG or a NPO, you're going to deal with the NPO first, okay? All right. Now, a lot of times what these questions will ask is they'll give you all these things that you should do, and then one of the options is going to be call the provider. All right. And so it becomes really, really tempting to select the call the provider option, right? You're like, well, I don't know what to do. I'm just going to call the provider, right? I'm going to tell you when you should call the provider, all right? Because that's always a very tempting option. And sometimes it is correct, sometimes it's not. So what you need to ask yourself is, does the patient have an immediate significant need that I need to address before leaving the room? Okay. Does the patient have a significant airway issue? Are they hemorrhaging? Have they just fallen? Okay. If they have an immediate need that you can address, do not leave and call the doctor. Take care of that immediate need, handle that, and then you can go call the doctor. All right. Is calling the doctor the most prudent first option? Okay. And that's what I really need you guys to keep in mind here with those. All right. Let's do another question here. This is a priority question, and it's a little tricky because all of these things need to be done. What should be the nurse's first action before administering an enema? Verify the physician's order, collect the appropriate equipment, arrange for the bathroom to be empty, or inform the patient about the procedure. Sarah says 1. Jessica 4. Paige, well, missed it. 2. Okay, great. Okay, so what you basically need to do is, how do each of these 4 options play into Maslow's, right? Verify the physician's order. Boom, that's a safety issue, right? Collect the appropriate equipment. That's implementation from our nursing process. 3, arrange for the bathroom to be empty. That's like feelings, privacy. 4, inform the patient about the procedure. That's education. So what is the most important? Well, most important is verify the physician's order. That's a safety issue. That comes before educating the patient. So we need to make sure that we have the order verified, it was signed, it's implemented, it's the right order before we do anything else. Okay, great. All right. So safety comes closest to airway before implementation, feelings, education, all that. All right. Now let's talk nursing process. For those that are in their first semester, hopefully you've already started covering nursing process. Before I put the nursing process up there, can somebody spell it out in the comments? All right. Nursing process is ADPI. Assess, diagnose, plan, implement, and evaluate. All right. Yes, ADPI. Perfect. Love it. Never break the nursing process. Now, this gets tricky, okay? And they're going to try to trick you. If a question's asking you what you should do first, you assess something. However, if there's assessment data and they ask what you do first, you intervene. Okay, so you build on the previous one. You assess, diagnose, plan, implement, evaluate. You don't skip something. If you have no idea what the question's asking, because that's what they can do, right? For those that have maybe already taken the NCLEX or whatever, you need to really follow that. Like if you're throwing this really random diagnosis, this really random medication, forget all that, go back to ADPI. Assess, diagnose, plan, implement, evaluate. Even if you have no clue what the question's even asking, follow ADPI. Here's a quick example of this, all right? And this example is a little bit of a stretch, but we'll go with it, all right? A patient is receiving oxygen via nasal cannula. After morning care, the patient experiences dyspnea and complains of feeling tired. When planning for the patient's bath the next day, the nurse should plan to 1. Give a complete bed bath quickly. Bathe only the body parts that need bathing. Arrange for several rest periods during morning care. Continue with the same plan because dyspnea is unavoidable. Now, if any of you pick 4, please don't pick 4. Great. All right. So what this question is really asking, and you can see up here, if you read the question, let's go back. When planning for the patient's bath the next day, the nurse should plan to, right? So they're telling you this is part of the planning portion of the nursing process. All right. So what you need to do is you then go down to your 4 options and say, which one of these is planning something? So in option 3, arranging is planning. You're arranging for several rest periods during your morning care. So what they sometimes will do is, do you simply know how to determine where you're at in the nursing process? Do you know how to take the next step in the nursing process? All right. That one's a pretty simple one. This one's a quick step here. Acute versus chronic. All right. content is king, okay? Content means everything. And what they're going to do with these types of questions is they're going to try to determine if you can identify acute symptoms versus chronic symptoms. So if you have a question about acute renal failure, one of the options will likely be chronic renal failure, okay? Yes, it was 3. So some of the ways that this can be written is it can be written acute versus chronic, it can be written short-term versus long-term, or you might see it as early signs versus late signs. There's not a huge strategy here, but what I want you to do as you're studying is really look at what are the acute, what are the short-term signs, what are the long-term signs, of pneumonia, of renal failure, of heart failure, of kidney, really look at what are the differences in acute versus chronic, okay? So that's kind of more of a study strategy there. Tip number 8, this one is trying to figure out what they're really asking, and what this was my biggest pitfall. This was my biggest downfall. This is where I struggle the most, okay? Because I would start reading a question, and as I'm reading the question, I start jumping to exactly what I think the answer is going to be, okay? And I say, before I even finish reading the question, I'm like, yep, got it, okay, and I start reading the answers without even finishing the question. Never do that. This one's really more about just slowing down and determining what is actually being asked, okay? If you're totally lost during a question, go back and read the part right before the question mark, right before they actually ask the question, because I'm telling you, some of these questions you're going to see are going to be like 10 paragraphs long, and then it's like the question is like, what's the patient's name, So always just make sure you understand exactly what's being asked. The first thing you need to do is remove distractors. Distractors are obviously wrong choices. All right, if you're getting a question about heart failure and one of the options like, you should go to give them some potato chips or something like that, that's obviously a distractor, and you just remove that, okay? And there will be ones on there that are honestly that ridiculous. And then you need to kind of simplify the question. By that, what I mean is think back to the very most simple part of what's being asked. If you're talking about a cirrhosis patient, simply think back to, okay, what does the liver do? What did I learn in anatomy and physiology? What's the function of the liver? And then never overthink it, okay? What happens a lot of times is nursing students start putting in all this exterior information, exterior data, trying to make the question work for them while it's, to make an answer work. Don't do that. And then determine if they're asking the correct or incorrect, for the correct or incorrect response. That's really where I fell a lot of times was, I'm reading it, and then at the very last part of the question, they're saying which response would indicate a need for further teaching. So really just slow down, read every single question, and determine exactly what you need to know. All right, tip number 9. Now I'm going to try not to confuse this, and I hope it makes sense. This is a really helpful tip because you're going to get a lot of questions like this, and I'm going to try to make it as clear as I can. So I'm going to do my best. All right. This is called duplicate facts. So what happens here is you're going to be given a question, and the options are going to each contain 2 or more facts in them, okay? Identical or similar facts appear in the options. And so what you're really trying to do is you're trying to determine which fact is incorrect, and then try to see where that appears in the different answer options. Once you identify one fact, quote unquote, as incorrect, eliminate all options that contain that fact. Now, I think reading through this question will actually make this make sense, okay? So here's the question. When monitoring a patient who is at risk for hemorrhage, the nurse should assess the patient for. Now, you've probably seen questions like this, I hope. And so what you see here is they're asking us 3 facts about the body. They're asking us about the skin condition, they're asking us about the blood pressure, and they're asking us about the pulse. All right? And so they're going to ask us 4 different scenarios of that, all right? So, warm, dry skin, hypotension, bounding pulse. Hypertension, bounding pulse, cold, clammy skin. Weak, thready pulse, so it should be thready pulse. Hypertension, warm, dry skin. Hypotension, cold, clammy skin, weak, thready pulse. So what we really have to do here is we're looking for, if we know one of these facts, if we know, with a patient who's hemorrhaging or at risk for hemorrhaging, they're going to be hypotensive. What we do is we go back to the question and we say, okay, anything that says hypertension, I can eliminate. So 2 and 3 say hypertension. Boom, I can eliminate those. All right, because I already know that hypotension is a sign of hemorrhage. All right, and then what we can do is we go in and we say, all right, I know that weak thready pulse is also a sign of someone who's at risk for for hemorrhage. So I can then say, look, what's the ones with weak thready pulse? Okay, boom, 4 has that. So I'll keep 4, weak thready pulse, 3. Okay, but I already eliminated hypertension. So by doing that, by working through the fact that I know and eliminating the answers that contain alternate facts, I can determine that 4 is correct. So I hope that made sense. That's a little bit difficult to explain, but basically what you're doing is you're looking for one that you know and then running with it, okay, as far as you can. Now, this really helps when you have 3 or more because it really gives you a higher chance of having a fact that you actually know, and then you can start eliminating other options. All right. So step number 10, this one is repeating words. Now, maybe you've done this before, maybe you've seen this before. This is really a last ditch effort. And I only want you to use this after you've used everything else. You've exhausted your knowledge bank and you have no clue what to do next. All right. So repeating words are what you need to do is you need to look at the question and look at the answer option. And you're looking for repeating words in the question and the answer option. Are there any words or concepts repeated? Okay. That can give clues to the right answer. Now, this is not an end-all be-all tip. This is a last-ditch effort, and I want you to only use it as that. All right. So, for example, if in the question they're asking about hypernatremia, and in the answer options, one of the answer options is sodium of 152. You start kind of pulling those repeating words together. All right. That's all you're doing here. Really a last-ditch effort. If you've tried everything else, exhausted everything else. All right. Lastly, guys, I want to talk about NCLEX question traps. All right. These are 6 traps that the NCLEX is going to throw at you to really see if anything else is if they can really try to trip you up. So one of the places I really love traveling is Pacific Northwest. I love the Pacific Northwest. It's beautiful. I love Oregon coast. I love Washington and all that. One of the things they do in the Pacific Northwest is they do crabbing. All right. And so the way they catch crabs is they put them in these little pots. These are called crab pots. And you can see the way they get them is they have this massive hole here. They put some stuff in there, drop these in the ocean, and the crabs crawl in there. All right. And once the crab crawls in there, they can't get out. They can see the whole ocean. They can see all their buddies swimming around right around them. And they don't even necessarily realize they're in a trap. All right. And so this is how these question traps work. They're built to trick you. Okay. The first question trap that you need to be aware of is no assessment is completed. If there is no assessment in the STEM, you need to assess, but it has to make sense. So there might not be any assessment even done. You don't even catch it. Boom, you jump into doing some nursing care and you didn't even realize there was no assessment. Number 2, an incomplete assessment. And we've kind of talked about this a little bit before. This is where I think nursing students fall in a trap more than anything else. All right. They see, so let me give you an example. So for example, let's say you're working on a med-surg floor, you're taking care of a diabetic patient, right? You walk into the patient's room, they're sweaty and they're shaky. All right. And the question is, what do you do next? All right. Where a lot of people will jump to, and as you're sitting here, with all your friends here, and we're just sitting here, it's easy to kind of think of what you would do next. However, when you're in the test and you're freaking out, you're anxious, what will happen a lot of times is you'll jump to somewhere you shouldn't jump to yet. We don't see, yeah. Okay, boom. Distress, no assess. Yes. So what you need to do is get a blood sugars, check a glucose level. But when you have an option there that's like, boom, give them some D50, it's really hard to avoid doing that because you're like thinking, man, I'm good. I got this. I assessed it. It's blood sugars. I'm going to give them D50. Never do that. They're going to try to trick you up with an incomplete assessment. Don't fall for that trap. Incorrect assessment. So what can happen here is the wrong assessment is put in as an option. And this really happens again when you start to assume things. Okay, so a wrong assessment's put in there and you're like, yeah, that sounds great. And so you start jumping after these wrong assessments. And that can really trip up a lot of people. Number 4, first does not always mean assessment. We talked about this when we talked about ADPI. What you want to do here is if they say, what should the nurse do first? It's not always assess. You need to look at, okay, what has already been done? What information do I have? And then I'm going to go and do what's next, okay? Along the same lines, action doesn't always mean implementation, okay? What's been done, what is the question asking, and go from there. Just because it says what action should the nurse take, it doesn't mean you're implementing. It could be you're assessing or whatever, all right? Lastly, you need to determine the outcome of each answer. We kind of talked about this in priority, but what you need to do is you need to say, if I go home right now, okay, if I go home right now, is the desired outcome for my patient done? Okay, so if I do this option and I go home, is it the desired outcome? Okay, so this again comes down to what usually happens is people start jumping ahead of themselves. So they start inferring things from a question. And this really comes down to critical thinking. You really have to think about, and I know that word, can be tough to hear, but you really just have to think about, if I do this option, I go home, what happens? Is the patient safe? Is the patient okay? Is it what I want to have happen? All right. So, you guys, what I want you guys to realize is tricks help, but knowledge is king. Okay, knowledge is everything. Yes, as May said, I'm gonna give a link here in just a minute with the PDF download for this. You can just go print it out, and it's gonna have the 11 steps on there. All right. So knowledge is king, and I want you guys to have all the knowledge you can get. Okay. What the problem is, and like this little GIF here shows, is that nursing school is a lot like drinking from a fire hose. We have students every now and then send us pictures of their stack of nursing books, and it's kind of depressingly hilarious, if that's something you can say. You simply you can't know everything. And trying to obtain all that information is pretty much impossible, okay? So the other problem, this looks almost exactly like the computer lab at my nursing school. When I saw this picture, I kind of had to put it on there, is nursing school can be really boring. You got all these PowerPoints, it's monotone, it's stale, and you're expected to cram 5 billion pages of information into your brain and then try to find it later. So I want to invite you guys to join the NRSNG Academy, try out the NRSNG Academy. In November 2016, I'm sure you guys have seen, we launched the NRSNG Academy to solve those problems. And in the NRSNG Academy, we incorporate our teaching method of providing you guys with a complete suite of nursing education materials in a way that you can understand it. And we've really been working on this since 2015 when we started it. So inside the Academy, we have our courses and we have our tools. And it really is an all-in-one suite secret weapon for dominating nursing school. All right. Thank you so much, Kat. The courses are divided up into, well, let me tell you some of the courses we have. So we have pharmacology, EKG, cardiac, med-surg, OB, peds, mental health, labs. And coming at the end of this month, I know I've teased to some of the people who are already members of the NRSNG Academy, we have a fundamentals course and we have a test taking course coming. So within each course, we have HD videos, we have outlines, we have transcripts for people who want to download transcripts or read the transcripts later. We have case studies, we have patient stories, we have cheat sheets, we have so much stuff in each course and in each module. Overall, we have almost 600 modules, and then we're adding all of our fundamentals, all of our test taking coming now too. And then what we do is we really teach, I think, our bread and butter, and what we've really defined as our bread and butter is boiling down all the content you're giving and giving you what you need to know. And we call these things linchpins. We that one piece of information that makes information click. It's kind of like Goldilocks. Like, we don't teach you too much, we don't teach you too little. And our theory is that once you learn it the right way, it will stick with you forever. And some of the tools we have in the academies, we have Simclex. I'm going to talk about that in a bit. We have nursing practice questions. We have flashcard app. We have an image database that's searchable, so you can kind of see visuals of everything. And then we also have cheat sheets, and we have an audio database with MP3 downloadable lectures. Let me tell you about what Simclex is. We just did a major update on Simclex, and I'm really happy with how it turned out. What Simclex is it's a computer adaptive testing platform that simulates what you see on the NCLEX. So 75 to 265 questions, easy or harder based on how you're doing. It really analyzes where you're at, gives you pass fail based on how you did. And you can see here, you get detailed rationales. It's divided up into 21 different nursing categories to really give you details on where you're struggling, where you're doing well. And it's a really cool tool. That's Simclex, and it's part of the NRSNG Academy. Some of the extras with the Academy, I just actually had to add it up last week, but we have over 800 pages of PDF course outlines with images, with bullet points, with everything you need to know. There's 3,500 questions in there and growing. I'm about to upload another 700 next week. We have content links if you want to dive deeper into Medscape and things like that. We have MP3 audio downloads. We have the private Facebook group for just the members of the Academy. We really call that our online study cohort. and you get lifetime access. And we have the computer adaptive testing. That's really not, well, I said computer adaptive testing. So computer adaptive testing through SimClex. And something that I'm really proud of that we offer is we offer a 200% money back guarantee or promise. If you use the NRSNG Academy, use the lessons, use the tools there, and you don't pass the NCLEX, we pay you back 200%, which means we pay you back whatever you paid, plus we double that. To date, again, we've just launched, in November, October, November. We haven't had to do that yet. And so I'm really proud of that. So what does it cost? I see a lot of people asking, what does it cost? What does it cost? What does it cost? What it costs is, a lot of other programs are going to charge you $400, $500 for just 3 months access. I'm not going to say who those programs are, obviously, but that comes out to about $166 a month. And then it's like, see you later. Have a great time. Good luck. So whether you pass or not, you pay them the $166 and they cut your access at about 3 months. Now, that seems crazy to me, and we did not want to do that at all. So what we did with the NRSNG Academy is we created it so you could get lifetime access and not pay forever. All right. So rather than charging you forever and ever and ever and ever, or ending your membership when we decide you should be ready in 3 months, you get it forever. So we want you to use NRSNG Academy we have some people in there who haven't even started nursing school yet. And we have some who are practicing on the floor. We have some instructors in there. We have medical students in there. We have people from all walks of life in there. And if all we've really done is taught you to pass a test, we failed. These testing strategies we've gone over tonight are really important, but that's not being a nurse. And so we really want you to do more than that. We want you to do more than just pass a test. So NRSNG Academy costs $49 for 9 months, and then it's yours for life. Any updates, any additions, any references you need, it's all yours. Or if you decide you only need it for 1 month, you pay for 1 month, boom, that's it. You just pay the $49, or you pay 2 months, 3 months, whatever, up to 9 months. After you've made your 9th payment, it's done, it's over. You keep it forever. All right. Does that make sense? But what I want to do tonight is I really appreciate you guys coming here. I appreciate you spending time with me. I know we had a little hiccup there with Mrs. Kai, my daughter, coming in and visiting us. So I want you guys to be able to start for just $1. We do the $1 membership, and I'm going to give you guys a code here to save $75 or like $8 a month over the course of the 9 months. All right. So I want you to write this code down. All right. If you have your pen and paper, write this code down. It's actually a URL. If you go to this URL, it will take you directly to the checkout page. It's nrsng.com/crushit. nrsng.com/crushit. And that will take you directly there. All right. And then also, there is the link right there for and I'm going to put a link in here actually in the chat. I think it should go directly to the chat. There's a link right there, nrsng.com/11 steps. That's the link to get the PDF download with the notes for tonight. All right. So nrsng.com/crushit. Keep bringing in the kids, Scott. You got it, Scott. Yes. I love Gary Vaynerchuk, and that's what I could think of for this URL for you guys. So Brett, yes, SimClex is included in NRSNG Academy. I'm going to turn my tour of the Academy. Do you want me to take you in on the inside? Which link for the PDF? It's nrsng.com/11 steps. Do you want me to do a tour, or do you want me to answer some of your questions? You guys let me know. We still got some time. Code expiration, there is no expiration on the code. So you can use the code anytime. Use it tonight, use it tomorrow, whatever. So Brianna, yes, it ends up being, it's like 400. Yeah, so it's like $375 or something if you do the code. All right. If you don't end up using it the whole 9 months, use it as long as you want. Tour, 450, yes, and then minus the 75. How long is the code good for? It never expires. What if I bought MedMaster and Cardiac already? Claire, please email Sandy, my wife, contact@nrsng.com, and she'll incorporate the cost of those into your Academy cost. Can those who already have NRSNG Academy use the code and save more? Courtney, if you already have the Academy, please email again my wife, and she can help get you set up. What was the code again? It is nrsng.com. Here, let me bring my nrsng.com/ again. nrsng.com/crushit. Yeah, you could absolutely use it along with any other program you're using for sure. What's her email? Contact contact@nrsng.com. Contact@nrsng.com. If you've already purchased something, she can look up your account and apply that. Sabrina, I will have to go back and look at your questions. I'm going to have them all up in a separate area. I might have to email you back later. Wife's email is contact@nrsng.com. Yes. How much for 1 month? So it's $49 a month for 9 months. If you use it for 2 months, it's $49 for those 2 months each, like $49 a month, $49 a month. If you use it for 1 month, just $49. 2 months, $49 times 2 minus the discount. Is it for LPNs or RNs? Catherine, great question. We created this specifically for NCLEX RN because all of us are. I assume it would definitely help with the PN exam. Oh, Sabrina, I'm gonna send you a longer email about that one. That's a great question. Daniel, these tips will help more in like nursing type exams rather than like anat and phys exams, chemistry exams. You really don't see this kind of stuff until you get later on in your nursing career. When is fundamentals and test taking coming? Fundamentals and test taking is coming in the end of this month. We have fundamentals pretty much all done. We're getting it finalized, and test taking is getting there too. So Kaylee, the reason it's cheaper on Amazon is because for those people who are willing to front the whole, I think it's $390 on Amazon. We want to give them a little break rather than those who are paying month to month. So that's the reason it's a little bit cheaper. Thank you, Scott. Put a lot of work into that PDF. I hope it's really helpful for you guys. I really do. Why don't we do a little tour? I'll take you guys around for those people that want to see the inside. Let me see. Let's go here. Those scrub sheets, I think, are really helpful for a lot of people. I think the scrub sheets are a great tool. I'm really proud of those. So this is what the Academy looks like on the inside. So once you create an account in the Academy, you come in here, and again, you guys, you can get started for $1 for a 3-day trial. Get in there, try it out, see if you like it, or see if you don't. Whatever. Give it 3 days. You don't lose much there. And to cancel your account, you have a whole account set up. So we have an intro video to kind of introduce you to it. We have FAQ videos outlined by what people are struggling with the most. Here's all your courses. I'll take you into one of the courses really quick. So here's the pediatrics course. We'll go into the impetigo lesson, for example. So it might be running a little bit slow just because I'm streaming and everything at the same time. So here you have your lesson. Some of the lessons are PowerPoint, some are whiteboard drawings. Then down here you have images, you have the outline, you have a patient story, you have the transcript, and here inside the pediatrics course, so here's the entire pediatrics course outlined by system. You have pediatric cheat sheets, you have quizzes, we have 5 quizzes in here, then we have 5 different case studies as well. We have a bunch of different cheat sheets. My wife's name is Sandy. So for example, different cheat sheets for different courses. This is the pediatric burn chart that's available in here that you can print off. So that's in all the courses. That's kind of basically how the courses work. Lessons, cheat sheets, quizzes, case studies, etc. Let me show you the flashcards. A lot of people really like the flashcards. So the flashcards, you can see here, you can toggle. Again, I'm sorry it's slow just with streaming here, guys. You can toggle between different categories. You flip it to see more. And the coolest thing about this, guys, is you can actually print these flashcards. And so you can actually select the categories you want to print, whether you want to do med term, medical Spanish, fundamentals, med surg. So that's a pretty cool feature. So you can take those along with you wherever you want to go. So that is the flashcards. Let me show you the image database. I think the image database is pretty cool. You're very welcome, Carla. Thank you. Please let us know. Again, it's going slow because so you can toggle again between here, different topics, cardiac. So you see this picture. This is a cardiomyopathic heart. And you can kind of just get the visuals of what you've been studying. We have images for EKG, GIGU, hematology, immunology, integumentary, all kinds of different stuff there. And then we have our audio database. Benjamin, we only have American values. That's a good question. We've had people asking us for Canadian values, and we need to add them in there. We have not yet. I'm going to add that to my list. So on this audio database, you can actually search by what you want to learn more about. It brings up all the different podcasts we've done. Like for example, heart failure, you can download it and see all that. Yes. So Morgan, the practice quizzes are usually, they're much shorter. So the practice quizzes are really like knowledge-based quizzes. They're like, did you understand these few topics? Where what I'm going to show you now. So in nursing practice questions, this is where we have our massive database of larger amounts of questions on the 21 different topics. So it's in nursing practice questions where you're going to get a huge amount of questions. So you can see we have it divided up by body system, and then we also have it divided up by NCLEX category, basic care and comfort, management of care. So we have a lot of questions on leadership. Critical thinking is going to be built in, this is for Fatima, critical thinking is going to be built into the test taking course, and then we're also going to build out more there. So nursing practice questions, sorry. So you can just start testing on any specific category. And what I usually suggest to people when they, suggest to people when they start the NRSNG Academy is to first start with a nursing practice questions test. Come in here, take a bunch of tests on a bunch of different topics. And the cool thing about it is you can see kind of where you rank up with other nurses and nursing students across the globe. So, you know, you submit your answer, we have select all that apply, we have all kinds of different questions in here. And then it's going to tell you, okay, 45% of nurses were getting that right. So, you know, it's about half and half, and then you have your rationale. So that's what I really like about nursing practice questions. If someone goes in there, takes a bunch of these practice tests in a bunch of different categories, they're going to see where they're weak and where they're strong based on their stats. And then they come back in here and start taking the courses on those topics, okay? And then SimCLEX, let me just show you. I took a SimCLEX a while back, rushed through it, so I could show you guys kind of what this looks like on the back end. It shows you by test. So this is for the one test. When I took it, what happened if I passed or failed, how far I made it, how many questions I got right. And then just for this one test, there is no limit, Bernie, on how many SimCLEX tests you can do. You can do as many as you want. This is for this one test. So in this one test, I answered 50% right in cardiac. You know, and you can really kind of work through here and see how you did on the different categories just for this one specific test. And then below that, it has all your questions and answers, okay? So I'm going to get what my categories were, and then I can click on this and start taking nursing practice questions on those topics. So I think that's pretty cool. How would we rate it with Kaplan? I don't want to disparage. If you read our sales page on there, nrsng.com/academy, we talk a little bit about it. Sarah, please, sorry, someone asked as a nursing instructor, please email us and we can get you some stuff as a nursing instructor. Where Kaplan and some of the other companies really focus on is they focus on giving you simply testing strategies, where our goal is to give you nursing education, like to give you a full suite of education materials versus strategies only take you so far. So what we've built is we built all the content you need in a way that you need it. How do you get the podcast? The podcasts are on iTunes, they're on Stitcher. So you can't just buy SimCLEX. No, SimCLEX is just available in the Academy. Yes, so Kelsey, you get everything in there. Everything I just showed you is everything you get for the $49. You get the courses, the flashcards, the video, the audio database, SimCLEX, nursing practice questions. So Adam, RN Crush is having a lot of issues. We are working on getting nursing practice questions kind of built into RN Crush. So yeah, podcasts are free. nrsng.com/11 steps would be where you find that. You have NCLEX study plans. That is going to be built in very soon, actually, to the Academy. I'm glad you mentioned that too. That's another tool that's going to be built in really soon. It's something that Susan's working on now is these NCLEX study plans based on where you're at. If you're a brand new student, if you're coming back, if you've already failed, if you need 4 weeks, 12 weeks, 6 weeks, whatever. Is everything printable in the Academy? The cheat sheets are printable. The books are printable too. The lessons are not printable. RN Crush is actually an app we have on iTunes or on Apple Store. It's not in the Academy. So we're really focusing more of our attention now into the Academy and nursing practice and stuff like that. I cannot contact Micah directly, Adam. I'm sorry. I wish I could help there. I really do. I'm sorry. I know I feel that I've heard they have good customer service, so maybe try that. Yes, we're getting the study guides built very soon. That's actually after we launched the Academy. I did a webinar with just the members of the Academy, kind of a private webinar, and that was one of the things they requested most was study plans. So we're getting those. So, Colleen, how close are the SimClicks to the question you're going to see on the NCLEX? What we've done is essentially what the NCLEX has done is we've broadcast out all of our questions, and we're collecting all of the data on how well students are doing on them, and then we're ranking those and delivering them just like the NCLEX. So they are not actual NCLEX questions. We can't do that. We can't publish actual NCLEX questions, but I feel that they match, and we're actually having people that have used the Academy, pass the NCLEX, come back, take the NCLEX or take the SimCLEX and kind of give us additional feedback so we can continue to fine tune that. How soon will the NCLEX layout be published? Those study plans probably will not be ready. There is not an app for the Academy, Diana. As you saw, there's so much information. We don't want it to be sluggish. We don't want it not to work. So the best way to use the Academy is going to be through the browser. It is incredibly mobile friendly. I should have brought up here where you could see how it looks on a mobile device, but it's incredibly mobile friendly, so it will work for sure on a mobile device. Yeah, for sure, Beth. So if you sign up, you get all the new things as updates and as we add them. Yeah, so we're continually making updates. If we hear something's not working, we definitely update it, or we add new things to it. New cheat sheets are coming and things like that. If you make it so, as long as you're a member, or if you do the whole 9 months and then have lifetime membership, you get access to everything forever for sure. So the nursing practice questions is on the site. You do get access to like 100 nursing practice questions on the site, and then they get the full access to nursing practice questions. It's like 15 a month, I think. So you get access to all the other material plus SimClicks for just the extra $20-$30. Joe, I really want to get these going. I want to give these away to people rather than selling them to you guys, but we're just working with trying to find a good t-shirt maker that I really like. I like this one we got, and so we'll probably get a bunch of these made up and send to people. Can we get more materials for the MedSurg review package? Yes, we're looking. MedSurg is on the docket for this year, getting more of that. And again, what we do within our SNG Academy, we're very conscious about what we add to it, because it's so easy to throw everything at you guys. But if we throw everything at you guys, we've simply become just another nursing school that has way too much information. And so we don't want to give you guys way too much information. We really try to give you exactly what you need to know. All right. And so we were very conscious, and we talk a lot about how we do that. So let's say I start the 9-month payment plan and then have to cancel or pause it because something happens when I resume. I'll have to start my 9 months over, or can I pick up where I left off in my payments? Sarah, we're not going to rip you off. So that's not our goal, is to rip you off and to screw you. You'll have to talk with Sandy about exactly how that works. But the biggest thing you gotta know is we're here to help you succeed. So I'm not going to charge you $150 and then for 3 months, and then you come back and charge you those over again. That's just messed up. So water bottles too. I hadn't thought about that. We could do some water bottles. How does the 200% policy work? Is it for real? Gabriella, we have not had to pay it out yet because no one has requested it. On the opposite side, everyone that has used the Academy has passed the NCLEX. But the way that it works is, if you buy the NRSNG Academy and take the NCLEX, okay, what we'll do, and let's say you fail, what we'll do is we'll look at how much you've paid up to that point. Let's say you used it for 3 months, and so we'll pay you the 150 or so as a repayment, and then we'll also pay you another 150. And I want to let you guys know too, what we do with that is we don't then kick you out. Like, we want you to maintain access in there. So if you paid the whole lifetime, let's say you did the whole 9 months, take the NCLEX fail, we'll pay you the 400 or whatever and another 400, and we want you to keep lifetime access. We're not kicking you out, because I truly believe that this is the best way to prepare for the NCLEX, and that's what we're making it better every day even. So yes, we're for real about that. We do request, and this is somewhat just out there. We do request you use the material, you take the SimCLEX, you do the courses, but you're going to do everything you can to pass. So that's what we want. Thanks for the even kill demeanor tonight. helps that you aren't jumping around like a certain individual in your same business. Okay. Nursing pins. I buy the crap out of those. Nursing pins. Nursing gel pens. Cool. Thanks, guys. Thanks, guys. Marketing brilliance. Predictability tests coming. So that's what SimClex really is. SimClex is designed to simulate the NCLEX. So rather than being a predictability test, we don't throw 75 questions at you and say, this is how you did. What we do is we say, you start taking the SimClex and it ends when it determines you either passed or failed. And what we're doing is we're continually adjusting that to get it as close to an actual NCLEX pass fail at the exact same point. Okay, so we're really working on that. So we don't do the predictability, rather we do SimClex. You get unlimited SimClex. Yes, Amber, please contact Sandy and she can help you with that. Thank you, Gabrielle. I put a lot of effort into this presentation. I really wanted to get a lot of information out there, guys, and I knew it was going to be a long presentation. And like I said, I got a little distracted there with my daughter, and I was a little bit sweaty, a little bit nervous, but I'm glad it helped you guys. Keely, thank you. We love you guys too. Marina, I stopped working on the floor about a year or so ago. Once NRSNG got to that point that we were reaching, the 4 million or the couple million people. So right now the website reaches about 600,000 people a month. And once it got to that point, I realized that the impact that I'm having on nursing is global, and we're able to help nurses learn in a way and give them, I hope, and I feel the motivation to help them go and to be better nurses. And so, yeah, I with the time requirement with this, I wasn't able to keep working on the floor. I tried as long as I could. I was down to working just 2 days every 2 weeks and just wasn't able to do it. Kurt, we don't have that set up to do yet. I would love to say yes, but we just don't have the ability to do that. Jennifer, how else is your program different than others? Well, I think, again, the biggest difference is that we have all the content out there. We're not simply giving you testing strategies. We have SimClex, which I think is huge. And then really the way that we teach is focused. So everything we do, we don't sit there and regurgitate what you learned in class. What we do is we break down the complicated topics into what you need to know and giving you that one piece that you need to know to really make it make sense. How long did I work as a nurse? I worked in the ICU for 2 years. Does the 200% work for people who've already failed a few times? Yes, absolutely. So care plans are not included in the fundamentals course. However, care plans are also on our docket for things to do in 2016. We're actually looking at doing a whole care plan course because that's something that I know a lot of nursing students struggle with. How do I feel about Patriots winning the Super Bowl? Beth, I'll answer that. Honestly, I wanted the Falcons to win just because the Patriots have won so many times, but that was a pretty spectacular game. Definitely. Do you have any study tips, guides? So we have a lot of stuff on there. I might have to come back and answer that later, Fatima, because we have a ton of stuff out there on the blog for free. Anything on care plans. So Robert, I want to give you a link. We have a ton of stuff on care plans already out there. If you type this, Google Google site, SITE, NRSNG.com, spacebar, care plans. And a ton of stuff is going to come up. We just wrote like 5 huge free blog posts about care plans, and we do have some stuff up there too on the podcast and things like that. So site, NRSNG.com, space, care plans. So you don't even do care. Yeah, concept maps. So I know a lot of people it's kind of a debate between care plans and concept maps. We are trying to determine which one we do and how that's going to work. So let me see. I want to make sure everybody, sorry, I'm trying to get back. So I want to make sure everybody sees, let's do this. So I'm just going to show you what it looks like. If you go to nrsng.com/crushit, it's going to take you directly to the checkout page where it's going to have that already applied and everything. And all you do is just go through and click continue to payment and you're all set. So that's how it'll work. and that's how you can go ahead and get set up with that, and get in there and start using it tonight for the $1 is what you'd be charged tonight, and then it'll just go until you 9 months. So Bernie, someone was asking that in the academy too, and I'm going to have to find where those are at. He's asking where to find the 4 MedCard template, and I have that somewhere. The free one that we have on the website right now is the one big one. I know that, and I'm going to have to find it. Okay, I'm going to have to find it. Yes, Scott, site nrsng.com/space care plans. Can I do 3 payments? Claire, I want to make that available. We just really don't have the ability to do that right now. Yes, 5 steps to writing a kick-ass nursing care plan. So does your offer end tonight? No, it doesn't end tonight. We don't have, we're not going to trick you guys into forcing you to buy something tonight that you're not prepared to buy tonight, or that you think you want to think about a little bit more. So I'm not going to trick you guys into something like that. The offer goes when you guys are ready to use it. Tina, please email that to Sandy. She'll get you set up with that. Kate, please email us, contact@nrsng.com. We are interested for sure in doing some of that stuff. So will the academy help pre-nursing waitlisted students prepare for their first semester? I think what you'll mostly get from that is if you want to get a head start on people. We don't have like stuff about before getting into nursing school, but if you want to go ahead and get a jump on that, and the fundamentals course will help you tremendously if you have a little bit of a jump on what's in fundamentals and what that's all about. So you guys, thanks so much. We've gone over an hour now. Chandra, I'm gonna have to email you that. I want to give that $1 for how long? Jennifer, the $1 is $1 for 3 days. You don't pay anything else. Then on that after that 3 days, the first billing happens automatically, and it will then happen automatically for the 9 times unless you go in there and cancel or whatever. So you guys, Jessica, so if you go in there and you type in what you want, and then over on the left, there's a download button. You just click download. That should work for you guys. You guys, I want you guys to succeed. We're here to help you. Please, get the nrsng.com/11 steps where you get the free PDF from tonight, or nrsng.com/crushit, where you can get, you obviously get the $1 trial, and you'll get the $75 off the lifetime membership. But we want you to succeed. If nothing else, please just follow us on social media and listen to the podcast, and we are here to help you. So NRSNG is awesome sauce. Thank you so much. You guys are awesome. I'm going to come back and look at some of these questions, and I will try to answer as many of them as possible. All right, guys, we love you guys. Thank you so much, and we'll talk to you soon. Have a good night.